recording. Let me go back to here and share screen and share. Okay, do you see my screen right now?
Yes, we can see it.
Yes. Last time we gave you PowerPoint. It has really in detail notes, okay? If you read that, you'll be fine. I made 7 questions from there. Today's lecture, I made 7 questions, okay? And next week, you'll be on your own. 6 questions will be there, okay? It's open book, okay? 60 minutes. Student who needs accommodation, they will have more time. But most people will be done in less than 20 minutes. But I'm asking one thing today. You have to print abstract A, B, and C before you take quiz. If you don't have printer, just save this on your desktop because you are in quiz mode and you should go Canvas and reading, then maybe impossible. Therefore, we are going to review this abstract A, B, and C. But I'm going to ask questions about abstract A, B, and C. Therefore, you should have print. You should have printed or at least save this in your desktop, okay? The quiz is really easy, but if you want to make an A, you should have a good grade. The paper portion and presentation portion, I assume everybody will get good grade. But the dilemma of this course is, I don't know whether you are ready to critique using Johns Hopkins nursing model, okay? Therefore, I'll show you what it means, okay? Let's look at the Johns Hopkins model. Yeah, I just make, this is quiz, isn't it? I have to go Johns Hopkins model, I have to close this. I think this is just coming again. Okay, this is Johns Hopkins model. Do you see Johns Hopkins model? Do you see?
I can see it, Dr. Sowa.
Okay, good. At the end of your textbook, there are appendix D, E, F, G, okay? Appendix D, it shows quantitative and qualitative. And you have to know whether it's quantitative, qualitative to critique your article. And appendix E, it has mixed method too. Appendix F is non-research. Therefore, appendix D and E is teaching you how to critique research. Appendix F show you how to critique non-research, okay? We hired new faculty. She's the supervisor in, I think, Essen Regional. Her DMP topic was Rapid Response Team Unit Protocol. That kind of thing is non-research, okay? She didn't do any original research. She reviewed many research and she made some unit protocol. Yeah, practice, clinical practice.
Dr. Sowa, I'm
Yes.
sorry to interrupt. This is Marquez. I think I think Michael is having trouble trying to log in. Do you need to let him in?
Leo, can you help him log in?
It's Michael.
I'm looking. I don't see anybody in the waiting room.
It's Michael Wells, Elvin
Okay.
Wells.
He's saying when he tries to enter the password, it's saying it's incorrect.
We don't need password, right? Did you use password? I don't think so. If you just click the link.
I'll send him the link right now.
Yes, thank you.
Thank you.
Going back to appendix F, okay? Therefore, if your question is, you want to improve some clinical practice at your bedside, you may choose some non-research path. If so, you have to use appendix F, okay? Appendix G is how to make the summary tool, okay? And I'm going to show evidence-based table. I made this, okay, because your book doesn't have any online resource. You have to fill out this. Do you see this one? Yeah, you have to choose 5 articles. And you should put author. You can just put first author, okay? And date, you can put just 2017, 2019, like that year, okay? Evidence type, you have to tell me whether it's research or non-research. And you have to tell me whether it's a quantitative or qualitative. And if you read it, you can tell me how sample size and setting kind of thing, okay? And you have to really fill out. Therefore, one article may be 1 page, and you have to talk about, if they have any measurement tool, you have to talk about that in case it is quantitative. And you have to talk about strengths and limitation. The article usually tell about their strengths and limitation and your critique. And you have to tell me it is level 1 or level 5, or whether this is high quality, good quality, or low quality. That's Johns Hopkins model is asking you. Last year, you did this as a group, okay? Johns Hopkins model is made to work as a group. Usually in that group, there are expert people, at least who has masters. They can lead you, okay? We just admit Michael Wells, okay? But in my opinion, it may be really challenging for you. Therefore, we made this because that's the requirement, but we are going to be generous when we grade, okay? If you have no idea how to grade, you can email me, I can help you. And quality, if you don't know high, good, and low, you can just put middle one, okay, good, okay? Evidence level, that should be really obvious. If you choose randomized control, it is level 1. If you choose really good experimental studies, level 1. If you chose quasi, the randomization was not done. The manipulation was not perfect. If so, it may be level 2, okay? Therefore, you have to give me this one, okay? I'm going to teach you about this in 3 weeks. I'm going to start right now. It will take for you to understand this. And I'm here available, Dr. Hop, and I can help you if you have problem to fill out this, okay? That's 20% of your grade, right? And 20% of grade is from your quiz. And your presentation and paper, I think you will do well. It's easy for you to get A make an A in this class. Okay, let's look at the grading rubric. Yeah, I made this based on your textbook. Your textbook doesn't give anything, okay? We don't get enough instructors support either. If I made this, yeah, here, if you choose less than 10 years old, you will get 20 points, okay? 5 of them, okay? If you categorize at least level 1, level 2, level 3, or high, good, low, if you have problem, you can consult with me, you will get full point, okay? And you have to show me that kind of table. And you talk about limitation, okay? You are going to type a little bit of a limitation about that study, right? And talk about strengths. And if you fill out everything, you will get almost perfect score. Therefore, don't worry about this. Dr. Hub and I thought this may be too challenging for you, but we'll be really generous when we grade this. Okay, right now, 8:13, everybody is going to, then do more should student put yes in chat button. Yes, okay, I'm just checking your attendance. Do more to student put yes in chat. Athens student put here in chat, okay? We are not giving any point for your attendance. I want to see at least who is missing today. I'm going to reach out to the person who was not here and I help the student, okay? Thank you for doing that. I'm going to open title analysis.
Dr. Sowa,
Yes.
Alex put in the chat box that Serena Frisbee is having problems getting in.
It's okay. She didn't get in yet at all?
No, yeah, they said she's having trouble logging in to Zoom, so she's having like computer difficulties at home.
It's okay, but still, it will be recorded and posted. Okay, you can help her, right? Can you send her link again?
Yeah.
Thank you so much. You're helping me. Okay, do you see the title?
Yes, we can see it, Dr. Sowa.
That's good. I see Lisa. Lisa, can you read the first title, please?
The lived experience of adoptive mothers of children with early complex trauma and attachment issues, a qualitative study.
Yeah, perfect. Good pronunciation. I can hear, okay? This is a study done by Dr. Anderson. You know Dr. Anderson, right? She became associate dean at the Morris campus. She's teaching right now, Patho Farm for the junior. This is her study. She got PhD last year, okay? And she got 2 awards from this study. Can you tell me whether this is quantitative or qualitative?
This one is qualitative.
Yes, qualitative study. It's obvious, right? We don't have any question, okay? Some title will tell you whether it's quantitative or qualitative, okay? Good job, Lisa. Marcus, you are going to read the second one.
Here goes. Reducing heart failure hospital readmissions, a systematic review of disease management programs.
Can you guess whether it's a qualitative or quantitative?
Probably quantitative.
Yes.
Hey, thank you.
Possibly it could be qualitative because we can do some systemic review of quantitative, but I can guess this is quantitative, okay? If you are suspicious, you have to actually read the abstract, okay? Good job. Okay, I'm going to go to Ethan. Bell, is Bell here? Bell.
Yes,
Can you read the third one, please?
Estimating the effects of non-pharmaceutical interventions on COVID-19 in Europe.
Okay, can you guess whether this is quantitative or qualitative?
Is it qualitative?
I think it's quantitative because it talks about effects, okay? Qualitative, usually we are trying to get insight of the people who are having that kind of phenomenon, getting their experience, okay? I think. Did you admit the last one, Leo?
Yes, it's back up to 85.
That's good. I think still we are missing several. Okay. This is quantitative. That's my guess. I didn't read it. But this is really good topic. Angela is interested in some pharmaceutical intervention on COVID-19. Okay, right? This is non-pharmaceutical. Therefore, you can make PICO easily, right? It's a quantitative study. You can get at least 5 good articles. You put non-pharmaceutical intervention and COVID-19, put randomized control or some experimental study, you'll get good one. Angela in Demoras, she's interested in pharmaceutical. She's interested in specific antiviral therapy. You can compare non-pharmaceutical versus pharmaceutical. That can be a good PICO, but you may find everything from pharmacy. It's not really oriented toward NURS. Okay, it may be hard for you to read the article, but you can try. I don't have any problem for that. Okay, the next one, Audra, can you read the next one?
Exploring factors influencing heart failure readmission.
It said exploring, right?
Yes.
Can you guess whether it's qualitative or quantitative?
Wouldn't it be qualitative?
Good job. Actually, that's my capstone dissertation topic. Okay, I'm going to share about this a little bit to teach you about qualitative. Yeah, I was a DNP student at University of Virginia. My specialty is heart failure, and I was involved in heart failure quality improvement project. And my preceptor, she has NP, but she doesn't have any doctorate degree. She was the head of the team. She approached me and asked me to do qualitative study for heart failure. But I didn't learn qualitative. Therefore, I had to go back to College of Public Health, and I took 2 classes on qualitative study. First one was qualitative methodology, 1 semester. Next semester, I had took 1 class, how to interpret quantitative and qualitative study. Therefore, qualitative is not for everybody, okay? Therefore, I'll share a little bit about this later, okay? So that you understand what is qualitative. Good job. Christine Carter. Are you there?
Yes, can you hear me?
Yes, can you read the next one?
Family violence and COVID-19, increasing vulnerability and reduced options for support. That's qualitative.
I think so. I didn't read this one, okay? I think it may be called qualitative. I have to read at least abstract, okay? Good job. Everybody is doing great. Jasmine Demarest. Are you there?
Which one?
Next one, Jasmine.
Okay, so I have hydroxychloroquine for early treatment of adults with mild COVID-19, a randomized controlled trial.
Is this quantitative or qualitative?
I want to say this is quantitative.
Correct, okay? We cannot do randomized control trial in qualitative study, okay? I think this drug is favored by our Mr. President, right?
Yep.
Okay, you can use this topic. It's okay. You can, to make PICO, you can put versus other antiviral, which is more effective. You can make PICO easily. I'm just sharing this so that you can start about your topic. If half of my class choose COVID-19, I'm fine. Okay, let's say you are living in dormitory. Because they know you are nursing student, they are asking what's the symptom difference between COVID-19 and just common cold. If so, you can make some teaching session, okay? That could be a really good PICO project, okay? You are going to use this and to post a session next semester. Therefore, just choose something you can use it. You don't have to redo it, okay? Just something that can be applicable to any setting. Therefore, I'm fine if you half of you choose COVID-19, okay? It can be applicable anywhere. If you go pediatric, just put pediatric population. If you go OB for your preceptorship, you can choose OB and but put just till COVID, okay? Last one. Matthew, can you read the last one?
Respiratory rehabilitation in elderly patients with COVID-19, randomized control study. That's a quantitative.
Perfect, okay? Therefore, you have some idea. You choose some topic, you choose top population, whether it's adult or pediatric or OB, you choose population and you choose topic, you choose COVID-19. You are interested in pharmacology or non-pharmacology or anything, okay? You are interested in breastfeeding, okay? If so, you can choose breastfeeding and put randomized control study. I don't know whether it was possible or not, but it doesn't have to be patient. It could be, we should choose something about nurses, okay? You want to improve nurses' satisfaction at bedside, okay? If so, you can put nurses' satisfaction. That's your topic. And you can put some experimental study, whether it's available or not. But I think many study may be qualitative, okay? It's okay, you can use qualitative. If you have problem in rating the quality, you can consult with me anytime, okay? Therefore, this Zoom link is always going to be applicable. You just email me, I'll give you this Zoom link and I can talk to you using Zoom, okay? Dr. Hop, and I'll be available to help you, okay? Good job. I think everybody got some idea about your topic already. That's my intention today. Okay, abstract A, B, C. You have to have this for your quiz, okay? Our Piedmont College didn't have this article, therefore I just got abstract, but I went to my graduate school and I got an article. Therefore, I post actual article for you, okay? And I didn't share. I'm doing the last clinical for my FNP. I'm going to substance abuse clinic starting next Wednesday. I'm so excited. That's my last clinical for my FNP. And
Congratulations.
I'm using my husband's GI Bill, okay? They are paying my housing too. It helped my living cost. I'm so excited. Okay, abstract A, okay? I'm going to ask somebody read for me, okay? Amber Ray in DemoRes, okay? Can you read the title, please?
Yes. So social emotional development of toddlers, randomized control trial of an office-based intervention.
Yeah, from here. Amber, tell me, is this quantitative or qualitative?
I would say quantitative.
Yes, it's quantitative, okay? Randomized control trial. We cannot do in qualitative. And if you see some intervention, usually that's quantitative, okay? Good job. And if you go the next section, I'm going to ask other people read it, okay? Brianna Crumley in Athens, can you read, can you go design and method section? Can you read, please?
A prospective double-blind randomized controlled trial using pre-test, post-test experimental design was used to examine the effectiveness of an office-based educational program to improve maternal confidence in the social emotional development of toddlers. The toddler care questionnaire was administered to all mothers as pre and post intervention tests. The treatment intervention was a videotaped parenting skills intervention on the social emotional development of toddlers and maternal confidence in caring for toddlers.
Thank you. It's obvious. It is repeating. It said control, randomized control. What is double blind? Can you guess? Researcher doesn't know whether the patient is in control group or standardized group, okay? Of course, patient doesn't know. Research nurse doesn't know. That's the double blind, okay? Therefore, let's say you are giving actual medicine and placebo, just sugar pill. When they swallow, they don't know whether it's sugar pill or actual medicine. And even researchers who are involved in doctor or NP who are involved in tests doesn't know. That's double blind. Prospective means you are following up. Why we follow up? Because we gave tests before and we have to give tests again later. Therefore, that's prospective. If you don't know anything, you are fine. But still, it said randomized control trial. Therefore, it's a quantitative. Therefore, when you rate level 1, 2, 3, 4, 5, you have to go at appendix and find the research, the quantitative research section and follow. I think I'm not going to read everything on this, but I have one question for you. What kind of method did they use to check whether the parent develop parenting skill? What kind of tool do they use?
A questionnaire.
Yes, but show what? DVD, right? It's obvious they show some DVD about parenting skill, and we collect data before we show the video, and we collect data later we show. Therefore, we can compare whether this intervention showing video about parenting skill help to improve parenting skill. That's the whole. Therefore, if you know how to read abstract, you can get a lot, okay? You can choose good article. Don't choose just 5 articles from the beginning, okay? You have to read at least abstract and choose, okay? And a librarian was available for demo last week. As a student, you didn't have that opportunity, but it was same. But this time, I think he emphasized to use CNAR, okay? That's really good approach, okay? Because we are more interested in nursing, okay? Therefore, if you start from online and senile and post-topic, okay, COVID-19, pharmacological intervention. Or if Marcus is interested in some social issue related to COVID infection rate, if so, you can put that kind of, okay, race, that kind of ethnicity or infection rate. And if you want to find some randomized control, you can put randomized control there. Then you have no problem to get. Okay, let's go back abstract B, okay? You are going to have this in your test, first quiz, okay? If you spend at least 2 hours next week and read that carefully, I think everybody will make about 95, okay? I want everybody have a good grade from this course, okay? You are going to have a bachelor's degree, okay? If you want to go master's program, your GPA should be at least 3.0. Therefore, you should get good grade. It can boost your grade. This course can boost your grade, okay? Abstract B, okay? Haley in Athens campus, okay? Haley Cordell.
Maintaining integrity, how nurses navigate boundaries in pediatric palliative care.
Can you guess whether it's a qualitative or quantitative?
Qualitative.
Good job. You are good. You are almost there, okay? Therefore, I don't mind if you choose qualitative, but it's hard to critique. I have problem, although I took 2 classes about qualitative, okay? Not all PhD graduates take qualitative, okay? Okay, purpose, somebody's still coming in, okay? I'm glad we are recording this, okay? Alexander Kincaid, can you read the purpose, please?
The purpose is to explore how nurses manage personal and professional boundaries in caring for seriously ill children and their families.
Explore. Yeah, we can explore even quantitative, but by just reading this, it's more likely qualitative. But the best way you can find whether it's qualitative, quantitative is you have to read design and method, okay? Jesus, can you read design and method?
Using a constructive grounded theory approach, a convenient sample of 18 registered nurses from 4 practice sites was interviewed using a semi-structured interview guide.
Okay. It said grounded theory. We are interested in some phenomenon, okay? Here we want to see some boundaries, nurses navigating boundary. That's the concept, that's phenomenon of interest. We try to make some kind of theory from this research. That's the grounded theory. If you don't know constructivist, just skip it, okay? You can analyze. If you don't know statistical analysis, just skip it. I'm not going to penalize, okay? But I took 3 statistics with PhD student. I'm pretty good at statistics. If you have problem in criticizing, you can email me. I can help you, okay? For my study, I have 5 questions, okay? Qualitative, you don't have to have any definite question, but still, you still have some loosely structured questionnaire. Therefore, it says semi-structured interview guide, okay? If you go results and read everything, you can tell, you don't see any number there, okay? They talk about what they found using words. That's qualitative. You are doing pretty good. I think you'll be okay to differentiate quantitative and qualitative. That's all I'm going to ask in your quiz, okay? The last one, okay? Brooke Demorest, okay? Can you read this title, please? Brooke, are you there? Okay, Brooke is not here. Okay, Maggie, can you read it, please? Margaret is not here. I think they went bathroom. I don't know. Okay,
I'm here. Sorry.
Okay.
Sorry, I forgot I was muted too.
Yeah. Can you read the title?
To see with my own eyes, experiences of family visits during phase 1 recovery.
By just reading title, can you guess whether it's quantitative or qualitative?
Qualitative?
Yes, but you have to read more, okay?
Right.
Okay, design. Okay, I'm going to ask Kimberly King, can you read the design?
This was a descriptive single group mixed method study.
Okay, it's a mixed method. It means they use both qualitative and quantitative, okay? Yeah, your Johns Hopkins model, they talk about mixed method. We are going to talk about this in 3 weeks when I talk about appraisal in detail, okay? This is mixed method. If you read a little more method, we can tell, okay, whether this is, okay, I'm going to ask one more person to read method section, okay? Elvin, Michael there? Wells?
Yes, I'm here.
Can you read the method?
Yes, methods, quantitative data gathered on the day of surgery was obtained from patients, vital signs, state anxiety scores, and their designated family members, state anxiety scores. Satisfaction with the visit was also measured. An optional second qualitative phase included a semi-structured interview examining the remembered experiences of patients and family members.
Yeah, it's obvious when you see this, there was quantitative section, right? Vital sign, that's number, right? Anxiety, we can define and we can measure anxiety. Lots of anxiety measurement tool is available, okay? And they measure not only patient, they measure family anxiety too. Therefore, we are talking about number, that's quantitative part, okay? And qualitative, not everybody attended, it's said optional. Some people, some family were approached and they asked about that experience. Therefore, this is mixed method. If you know this, you will be fine for your quiz, okay? But if you may not remember this when you take quiz, okay? Therefore, I'm asking you whether you can save this on your desktop or whether you can print for your quiz 1, okay? Quiz 1, if you can differentiate research and evidence practice, what's the role of the evidence-based practice of nurses? The kind of simple one, okay? You should be fine, okay? I'm going to, do you have a question? Okay.
Yes, Dr. Sowa, I was going to ask, so then are the options going to be qualitative, quantitative, and mixed methods?
Yes.
Okay.
But this will help you when you choose your article for your evidence-based practice paper you are going to write, okay? That's the reason. I'm not forcing you, do not choose qualitative, but I'm telling you qualitative is PhD level, okay? But
okay, thank you.
If you choose COVID-19, some kind of, you are interested in patients, patient is dying alone. If you're interested in family experience when your significant others are dying during COVID, I think right now, there's no way we can do quantitative of study. You may be interested in qualitative. I think qualitative study about that topic is out there. You have to read qualitative and you can do it, okay? I'll help you, okay? It's hard, even for me, it's hard for me to critique qualitative study. You have to look at the author. Do they have PhD? Maybe that shouldn't be a judgment, but you have to look at what journal do they publish, okay? That kind of author's credential may be really important point too, okay? But I can help you if you choose qualitative, okay? I'm not expert, although I spent 1 year. Most people can finish DNP in 2 years, but I finished in 3 years because they asked me to do qualitative study. Therefore, I'm going to share about my qualitative study about 10 minutes, okay? I'm not going to spend that long. Then I'm going to give you break, okay? Then we are going back to our intended one, okay? This is my capstone presentation. Let me make a little bit.
Dr. Sowa?
Yes.
Hey, sorry to interrupt. Will we be taking this quiz in the lockdown browser, or will we be taking it, or like, how is that?
I think it's a lockdown browser, yeah. But it's scrambled. You have to take by yourself, okay? But it's easy question. If you know just basic concept, you have no problem. But I emphasize you'll be okay last week on today's portion, okay? But next week you'll be on your own, and we are giving 3 chapter summary, right? If you read that, it may take only 1 hour. You have no problem to pick up right question, okay? I think everybody will get 90, above 90, okay? Do you see my PowerPoint?
Yes, we can see it.
Yes.
Too small? How can I make a little bigger? There are plus button.
It's down in the right lower corner. You see the 50%. You can slide that over if you need to make it bigger.
I don't see 50%.
The bottom right corner.
Right corner?
Go up a little bit. Okay, go down just a little bit.
I think
down.
I see student's face. Not okay. Let me minimize. Okay. I don't see 50%.
Down just a little bit. Keep going down. Oh, there you go. Okay, now move over to the right. To the right.
I don't see.
Keep going. It's all the way in the right on that same line.
Yeah, I see my Zoom meeting ID is there. How can I get rid of my Zoom meeting ID? Make big. Yeah, my Zoom meeting ID is there. I cannot see that.
I think the size of the font's okay right now. You might have to zoom it later when you get to a smaller font.
Okay, good. Yeah, I'm just sharing. I'm not going through everything to show what is qualitative, okay? This is actual presentation I did to defend, okay? I present this at Piedmont College, I think July 3rd, and I got the job and I defended at July 7th, okay? And my advisor, Dr. Killing, she has PhD, but she didn't know anything about qualitative, okay? Therefore, qualitative is really hard, okay? Leo, my husband is using Leo right now as his name today. Leo is my dog, okay? He's dead right now, okay? And when I presented, I acknowledged my parents. They never attended any college, okay? Therefore, higher education is really important if you are first generation student, okay? And we usually start from problem. I have to emphasize the problem. So many people have problem, and many people come to hospital with this heart failure, and how much money we are spending. That's what I have emphasized in problem. I continue, okay? For the hospital to get accreditation, the Center for Medicaid and Medicare, they emphasize you shouldn't have so many people coming back with same diagnosis. For example, heart failure, heart attack, or pneumonia. If they come back in 30 days with the same diagnosis, they are blaming hospital. You didn't do a good job. Okay, that's the reason we had to improve our heart failure readmission rate. That's the reason my preceptor asked me to do qualitative study. But so many quantitative study was done. There are multiple factors affecting heart failure, okay? And they spend tons of money. It may be just not $1 million, it may $1 billion was spent to find out why people are coming back with same problem again and again. Therefore, quantitative study failed to give us answer. That's the reason they asked me to do qualitative. And my study is done only at University of Virginia, that setting, okay? And this is the one, when I put patient readmission and heart failure and qualitative research and factors for interview, like experience, that kind of work, I got 1,295. That's my starting point. But I have to narrow down, okay? And the third step, I got 105. But after I review the abstract and everything, I chose 31 study, okay? Therefore, when you write paper, you have to tell me, okay, how you end up with that's 5 good article, okay? Okay, always when you do any study, you have to tell there's a gap. we have some knowledge available, but we still need new knowledge. That's the starting point whenever you talk about research. Therefore, when you do this paper, you have to tell me why you chose that topic. You have to tell me that was your burning question because something is going on in this society. Something is happening in patient, family suffering, okay, nurses are suffering. If your topic is improving nursing retention. If so, you have to tell me. Nurse doesn't stay at bedside. You have to tell me what's going on, okay? We used to teach theory in research course. We got rid of it, okay? We always have to have some framework of looking at your problem. This will make you think about that topic again, develop question. After you collect all the data, you have to go back to that framework and we are going to organize our ideas. That's the framework. I'm not going to repeat this, okay? Always you have to have some purpose. From your paper, if you write perfect, that's perfect, okay? I'm not going to read this, okay? I developed 2 questions there. And design and sample, of course, this is qualitative. I'm asking the experience of patients who are coming back to hospital with same problem in 30 days, okay? They are really sick people. I had hard time to find 9 patients, okay? And we need some IRB approval. I did only for 4 months, but I got 9 patients. After I listened to the 9 patient story, I can tell I don't have to listen anymore, okay? That we call that saturation, okay? Qualitative, some people can achieve that saturation in 5 patients, okay? One of my classmates went India, she's from India. Her topic was the experience of the woman's having seizure, okay? In India, in their culture, having seizure, when they marry, they hide their problem, okay? Nobody wants to marry a woman with seizure disorder. Therefore, that was her topic, and she achieved that. Saturation means they are talking about same thing at 5. Therefore, there's no number of sample size in qualitative study, okay? I'm just giving you what is qualitative, okay? You may feel better. This is my, when I choose sample, they have to meet this criteria. But someone who cannot speak English, I cannot do because I cannot speak Spanish. I cannot speak other language, okay? And I exclude several people. I worked in the unit, we used left ventricle assist device. We didn't include that one, okay? And some people come back to hospital to get some kind of procedure. I excluded, okay? I not only interview patient, I review their medical record. What they are talking to me is that same when I review doctor's note, nurse's note. I review everything, okay? That is called triangulation, okay? To give more trustworthiness, credibility of the study, I got 2, okay, from interview, and I review their record, all the note, okay? Therefore, I made this 5 open-ended questions. Of course, I got this from literature review, okay? By reading so many articles, I developed this. And when I told you I review medical record, everything is online. I made this, I went through this, okay? Of course, this is done from my reading from other previous study, okay? And my husband helped me to transcribe, okay? My patient was too sick. It took only some 33 minutes. Some people just couldn't continue at 15 minutes. Some people, if it's 1 hour session, if you transcribe, it may take about 50 pages, okay? Some people use the actual professional transcript person, okay? Right now, computer program is available. The computer is going to transcribe for you, and even they can give you some pattern theme, okay? But I did everything manually, okay? This is the I'm explaining who are they, okay? Most quantitative, qualitative study, they are explaining about their participant and patient, okay? At University of Virginia, that's teaching hospital, okay? We have a really great program. We hire nurse navigator. Therefore, if the patient is admitted with heart failure, nurse navigator go and teach it. They, of course, social worker and case manager meet the patient already. And this person is trained to teach about heart failure. They include family member because we believe, because we didn't give perfect teaching, that may be the reason. They may not take the medication. They may not check their weight every day. That's when we are giving that kind of inpatient teaching. H2H means when the patient go home from hospital to home, 30 days we are following up in a week, in 2 weeks, and in 1 month, because we cannot be paid if they come back in 2 weeks or 3 weeks. We give this kind of program free, whether you have insurance or not. 3H, he's my preceptor. He used to be a manager at heart failure unit. He become NP and he's doing this. He's sending home health aid to the patient's home. And the home health aid is iPad. And they do vital and they talk to the patient, and the NP is in his office, and they connect, okay, using really secured computer, the kind of security in internet, and that even the home health aid can show the swelling of the legs, okay? Therefore, there we can talk to the patient, and home health aid is there, NP can even change the medication dose. Okay, today you are going to double dose that Lasix, 3 days, and please wait every day, and please call us. That kind of thing is heart health at home. We did this kind of good program, okay? This picture of how we did it. And I don't have to continue anymore. Yeah, several themes emerged, okay, from my qualitative analysis, okay? This one is actually, I just put something what the patient is telling me, okay? That's qualitative, okay? I think that should be enough for me to tell you what is qualitative. Did you get enough about qualitative?
Yes, Dr. Sowa.
Okay, I think that should be enough, okay? Right now, I'm going to give you 9 minutes break, okay? You can go bathroom. We are coming back at 10 o'clock. And it'll take about 30 minutes when I review my PowerPoint, okay? I think everything I gave to you so that you can start your topic and you can take quiz, but still I'll review briefly. But I'm going to repeat this in 3 weeks. I think the repeating may be the only way you can understand basic concept. If you understand basic concept, you may be okay. You may feel more interested in research. Some people hate research because they don't understand terminology, okay? Therefore, I'm going to stop recording. You will come back 10 o'clock. Billy, can you help me?
You mean 9 o'clock?
Okay, I have to stop recording. How can I stop recording? Okay, let me go. Can you stop recording or stop share recording? I have to stop this one.